each table, big table. Come on, one person each. Let's go.
Come on, Lex.
Wins the points, okay? You can huddle together.
You have 1, 2, 3, 4 medical cards.
Okay, all right, we have our teams. Okay, so let's go. We'll let this team pick since they gave up a member.
Has Charmaine's table set with somebody?
Prevention for 50, please. That's how this works. This is a tough one. Dressings, fluid, blood, or gloves. What do all these things have in common? That's a good one. Is that your answer? So the answer here that we got from this team is, can you give us the answer? I know what it is. What are items that actually do not belong in the sharps container? Oh, that hurts. Sorry. Negative 50 over here. Negative 50. All right, Greg, why don't you give us our next category?
Let's go. Common risk factors, 50 points.
Yeah.
Woo, we're going big points.
50.
Too bad. Not using precautions in healthcare workers. What do they have in common?
Is it risk for HIV?
Who are at increased risk? They win 50 points. All right. We're going to let you go. It's your turn.
We want common blood pathogens.
We're just bringing on 50 points. The standard for limiting exposure to bloodborne pathogens. What is the standard?
Hand washing.
They say, what is hand washing? What do you say?
What is your first precaution?
Safe practice, 50 points.
Unsafe practice, 50 points.
Yes.
A simple way to reduce. What is hand washing? All right, come on team, you gotta get it going. Last 50. about that?
That's disgusting.
There's your answer.
What is disgusting?
He flipped it on to
Oh,
We're gonna get that one to you. We're gonna get that one to you. Okay.
Bodily fluids for 40.
Bodily fluids for 40, please. Common and GI illness that may contain a bloodborne pathogen. Not always, but just in case. A bodily fluid, common and GI illness.
Yes, what is vomit?
What is vomit? Gross. Are you hungry yet? It's time for lunch, isn't it? Okay. Janice, give us your next plan. Unsafe practices for employees. And then hold to the next. An important piece of personal protective equipment. Informal question. What are gloves?
Gloves?
Answer is, what are gloves? All right, Greg.
Let's go. Alright, common blood for 40.
Common blood pathogens for 40, please. What is Ebola? Alright. Teresa, what do you want here? Common blood pathogens for 30, please. Okay, a form of hepatitis that can be prevented. A 3-part vaccine. Hepatitis B is the one that can't go up. So get your shots, 3-part series. Okay, let's see what's next. Common risk factors, please, for 40. Estimate of greater than 500,000 of this group are exposed annually to a bloodborne pathogen.
HPVR.
It's a group. So, a group of people who get exposed annually to a bloodborne pathogen. Who are healthcare workers? 500,000 a year get exposed to bloodborne pathogens. As we're watching the news, we know the radio. Okay. Prevention for 40, please. Washing hands, wearing gloves, using a single-dose vial, using a needle or syringe only once. What is this?
What are methods of preventing infection?
The answer is what are universal precautions, which I'm going to accept, but it's also part of what are safe injection practices for our nurses. Those are part of universal precautions. Yes, they are. So we're going to give them that.
Yes. Bodily fluids for 30.
Bodily fluids for 30. Let's see if we get grossed out before lunch. An area of the body if exposed may increase the risk of transmission. The area of the body if exposed may increase the risk of transmission. All right, come on, you answer. It's almost lunch time. We're going out lunch. What are eyes? That is almost right, right? I'm going to give it to you. Okay. Here we go. What do you want, folks? Common risk factors for 30, please. How do you define risky sexual behavior? Your clients in the office and they're telling you about their sexual past.
Healthcare workers.
We're good when we get it the second time.
Unsafe practices.
Can't do it.
Where is the skill kit located?
On top of the bridge.
Where is the skill kit?
Like in general and what?
In every part of the agency, where is the skill kit located?
Harbor House. I don't even know what skill kit is. Paper towel?
It's what is, okay, you give the answer. It's what is the emergency.
Okay, we're gonna be over here looking at this video.
First take down. Plastic bag.
Who should be reporting an exposure of bloodborne pathogens to?
DR doc?
In your office, this is the office. Who is your supervisor? This is different where you work. You need to tell your supervisor if you were exposed, you're afraid of. It's not me, it's your supervisor. Okay.
Follow the list, we're coming.
I see a pattern here, Greg.
Follow the list.
Our largest organ defense, when it broke in, they increased it.
What is the skin?
That's easy. Prevention for 20 minutes. Okay, this is kind of a tough one. Must be transported for disposal via an incinerator, authorized, regulated medical waste disposal facility. Sure. What is biohazardous waste? Right, awesome. I don't know where we're at. How are we doing here?
1 million.
A viral illness that attacks the immune system. What is HIV? Common risk factors for 20, please. Popular skin irritation. So you increase your risk when you're going to a tattoo parlor because they may or may not be using the appropriate equipment. So if they look good, I'm not saying they don't. I'm just saying it doesn't increase your risk for having let's keep down a little bit. One of our providers, she just told us about, it's not just about the needles and tattooing. It's not just about the needles and tattooing, but blood can also be in the ink. So they go in and have the ink into your skin. Well, you think there might be a little blood there? I've seen some fresh tattoos. They're kind of red and angry. And if that is in the ink, if that blood becomes in the ink, then now you've been exposed. So just a little thought for you. As you think about going out and getting your weekend tattoo. Every weekend. Okay, unsafe practices for 20 please. A common error causing most needle sticks. This is how our healthcare workers become infected by frequently. What is trying to happen? Happen the needle. most common cause of healthcare exposure to bloodborne pathogens? What is the most common exposure?
Drinking blood.
What are needle sticks? So our nurses, we really need to take care when we're giving injections to our clients. We do still give injections in this agency too, and we have to remember our safe needle practices. We've only got a couple.
Obviously, Bob was British protection.
Oh, why would you just say that? If you don't make this one right, you're in trouble.
What's blood?
What is blood? Well, you guys started from the bottom and worked your way up. That's not usually how it goes. All right, what is blood? Prevention from 10, please. What are the sharps contained? An approved sharps container, and that doesn't include a shoebox in your office. It's not where the sharps belong. And last, a common viral illness affecting the liver and very common in drug use.
Addiction.
What is? That's it.
Winner!